Senator Jeff Merkley, thanks for giving us a few minutes of your time today. I know it's a busy day for you here. You're back on Capitol Hill. Two questions about that, because I see you're in your Senate office there. How empty was the airplane when you traveled? And do you agree with the joint statement from Mitch McConnell and Nancy Pelosi to forego testing for the people in the House and Senate for right now?
Well, I can tell you the plane didn't have any of the middle seats filled deliberately, and I appreciated that. A lot of empty seats on the plane in addition. So it was very low, and this was after multiple other flights were canceled. Air travel has collapsed along with the explosion of so many other businesses in our economy. Here on Capitol Hill, it's like a ghost town. I'm the only member of my team here in the office. Everyone else is working electronically. Even when I go out in the hallway, you see no one other than the security personnel at the doors. So it's a very strange feeling. I don't think that members of Congress should be tested any differently than other members of the population. If we have risk factors or we've been in contact with somebody with a risk factor, then it's appropriate. But I want members of Congress to have the same experience that everyone else in America is having.
And I know that there's been a lot of talk lately about contact tracing and stuff. And you're a big privacy advocate. Do you have any privacy concerns about increased contact tracing?
I don't have concerns if it's done right. And by done right, that is the way it's been done for other pandemics. You go to a person who's infected, you find out who they've been in contact with, you knock on the door of those folks and say, you may be at risk. Would you like to be tested? We'd like to have you tested in case you're asymptomatic, but have the disease, because that endangers people you'll be around. Most people want to be tested in that situation for their own health and for the health of others around them. And if you trace that back at least 2 links from each person, then you really start to understand how the disease is moving, which can guide public policy as well as helping those that you're directly in contact with from further spreading the disease. What I am concerned about are the idea that we're going to track Americans through their cell phone contacts. Basically, that to me, that's unacceptable invasion of privacy. Let's do it by talking to the people who test positive, and then talking to the folks they've been meeting with.
And do you really think the cell phone thing won't happen?
I don't know. It's up in the air right now, and just the fact that the tech companies are saying, hey, we've got this great solution. We'll take all this data we collected on how people move around the country and disclose people's private journeys. Bothers me a lot. It's really about the loss of privacy in America in a way that I've been expressing concern about for years, about the too widespread use of facial recognition or cell phone tracking. This is like, it's a scary, futuristic society where everyone is monitored every moment, either by private business or by the government.
2 real quick questions, they're quick questions. I don't know if they're quick answers, because I know you got some time to go here. It's National Nurses Day today. I know you have some healthcare providers in your family. Do you have any thoughts about nurses in this time of the pandemic?
Well, it has been very scary for healthcare workers in general and nurses. And this is a moment this week, National Nurses Week, to reach out to healthcare workers, and thank them for what they're doing. Because they've been doing their work despite a lot of risk and a lot of anxiety. I do have healthcare workers in my family. My son is a medical scribe who is in office with the patient, kind of getting all the electronic information recorded accurately. My wife is a nurse, a hospice nurse, who goes in and meets with patients who are very, very sick and their families. These are high-risk settings, and we haven't had the sort of personal protective equipment we needed for all healthcare workers to be safe. We've seen a high rate of infection among healthcare workers, so they've been doing their work despite the danger. But this reflects both the need to thank them, but also to say it's not acceptable that we haven't geared up faster on personal protective equipment. So every American in every line of work can have the protection they need to do their work without a high risk of infection. And this is key to reopening the economy, that personal protective equipment and the contact tracing, so we can really figure out where the disease is moving and shut it down.
Last question for you, Senator. There's been a lot of talk about the food supply recently, and I know you've been working to get more money in the coronavirus relief bills for agricultural producers and small farmers and stuff. So where does this stand now, and is the money flowing to the farmers who need it the most?
Well, I had success in making ag producers eligible for the economic injury disaster loans, so that's a step forward. I want to see them be eligible for the Paycheck Protection Program across the ag world. I'm pushing for extra help for some hard-hit areas, including our seafood producers. The government can buy the seafood that would normally be sold in restaurants and send it to food banks, thereby sustaining that part of the economy, and can also provide $1 billion of support through NOAA for disaster support for hard-hit fishing communities. So those are some of the pieces that I think are essential to undertake.
Well, Senator, thank you for giving us a few minutes of your time today. I know there may not be a lot of people in Capitol Hill, but you're still a busy guy, and we always appreciate you chatting with us.
You're very welcome, Tim. Take care, and maybe both have good luck finding a barber down the line.
Thanks a lot.
Take care.